Do we have an idea of how many people registered?
Jeff said around 50.
Nice.
Are we recording this, by the way, guys?
We should.
We
let's-
really should. Yeah.
We absolutely should. Is there a way to make sure that we do?
It is set to record and automatically in the cloud.
Awesome. Thanks, Chris.
And so are we kind of good to go here when it's 8 o'clock? I can go ahead and start. Is there any other buttons to push?
Yeah, that looks good.
Okay, sweet.
And Noman, I did send you that background should you want to change it,
Oh.
but your background's nice, so.
Let me see. I don't have enough time to mess with it right now.
Forget about it.
Forget about it. Yeah, Jay, when you were talking like that, all I thought about was Chris Karam.
Love that guy.
Yeah.
He called me up a day before internship started. He was like, yo, you want to trade internships? I was like, nah. I just got an apartment in Jersey. Forget about it.
He's like, but I know a guy.
I got a guy.
He's such an awesome person. He's like, how's everything going? He's like, I had my 4th kid. I was like, wow.
I kind of jacked that up, didn't I, Mike? It's not I know a guy, it's I got a guy.
Yeah, I wasn't gonna be too picky.
No, I was kind of to get it.
I love it.
Sandra, thanks for joining us.
It's an honor.
Oh yeah, everyone. This is Dr. Sandra Victor.
I'm Dr. Anthony's mentee.
That's awesome. You're in great hands, and we're looking forward to you excelling in your career.
Oh, thank you. Nice to meet you all.
If there's anything that we can do for you, let us know.
Yeah, if Ajay didn't teach us something, we'll be happy to fill in.
Yeah.
Yeah.
He does a lot of trigger points, and he writes a lot of high-dose opioids, right?
That'll be
Right.
nice.
Absolutely. So I'm trying to
Good.
unlearn everything.
Could we all do the same, so don't worry.
Yeah.
All right. It is 8 o'clock, everybody, and we'll just give everyone another minute or so before we get started. Okay, welcome. It is just after 8 o'clock, and as people trickle in here, we will go ahead and get started. I want to welcome everyone to our first of several in a series of webinars dedicated to trainees and incoming fellows for this upcoming academic year. My name is Ajay Anthony. I'm an interventional pain physician in Gainesville, Florida. And I just want to thank everyone for joining us virtually and in these difficult times, wishing everyone safety and wellness. And with the Florida Society of Pain and Neuroscience, I'm going to kick it over to our president, Dr. Noman Azim, who is going to just outline the missions and the goals of our society that certainly focus on clinical excellence, furthering the field of research, and then also the focus today being teaching. So Dr. Noman Azim.
Great, thank you, Ajay. Good evening, everyone. As Ajay said, my name is Dr. Noman Azim. I'm the current president of the Florida Society of Pain and Neuroscience, and I'd like to welcome everyone this evening as well. We appreciate you guys taking the time away from, your personal lives during this pandemic to really join us to talk about how we can maximize pain fellowships and how you can get the most out of it. So I wanted to take a moment to introduce you guys to the Florida Society of Pain and Neuroscience, FSPN. So as a society, our mission is to advance interventional pain medicine and neurosciences with a focus on really cutting edge novel treatments to establish best practices. We'll accomplish this by a few different ways. Really want to engage in research, want to engage in data collection, education, and engagement of both the younger pain docs, such as yourselves, and training, as well as established pain docs that really want to expand their horizons. We really do want to make this a society that does collaborate well with the existing state societies so that we can really accomplish the advancement of our space overall. So we, again, welcome. We will, have a very robust conversation tonight, I'm sure. Please submit any questions that you guys have so that we can make this as interactive as possible. And towards the end of this, if there's any questions regarding membership, we will have our website available for you guys to, log in and try to, join if you guys are interested. With that, I'll pass it back on to Ajay.
Okay, let me just go ahead and take a few seconds to introduce the rest of our panel. You met Dr. Noman Azim already. We also have Dr. Navdeep Jassal, who's coming to us from Tampa. We have Dr. Michael Esposito, who's coming from the Space Coast of Florida. We have myself, who's in Gainesville, Florida. And then we also have a very special guest today, Dr. Sandra Victor, who is just finishing up her pain fellowship at the University of Florida, and actually will be staying on faculty there and starting in just a few days as an attending physician and transitioning to that next part of her career. So we're really excited to hear from her and her sharing her perspective as well. I will be moderating the webinar for the next 45 or 50 minutes or so. We definitely want to encourage you to ask questions through our chat box, and we'll go ahead and keep monitoring those and answer those as we go. But I just want to start off the evening and just kick it over to Dr. Jassal and maybe go down the line in terms of sharing a pearl about their transition from fellowship to being an attending physician, and maybe one thing you wish you knew.
Sure. Of course, it's an honor to be here with all of you, and I'm actually very looking forward to having Dr. Victor say a few words today, and I'm really excited about her insight that she's going to bring to our conversation today. In terms of a pearl, I wish that someone told me, and I know that everyone has heard this, but I really wish that someone had enforced how important it is and how critical it is to learn as much as you can in the small amount of time that's allotted. And everyone knows that, you have a 1 year to really grasp as much fundamental knowledge about interventional pain management, but truly what is 1 year, especially in the unique circumstances of where we are today with COVID and it truncating a lot of your guys' fellowship training. So if I could do it all over again, I would just really grasp the importance of 1 year of fellowship training and make the best of every single second.
Awesome. Dr. Azim?
That's a great point. Again, just to kind of jump off of what Dr. Jassal was saying is, it's a very short year. You kind of get into it, and before you know it, it's over. I'd say there could never be enough repetition. In my fellowship, we did a lot of these high-level procedures like SCS, peripheral field stimulation, kyphos, pumps, all that stuff. But even with that, I took as much time as I could, extra time, when I was supposed to be on vacation and, when I was on call or post-call, and still trying to get in and just get a peek at, a new procedure or try to get my hands dirty again. The other thing was that you want to take advantage of industry during your fellowship. There's a lot of fantastic fellowship courses that are out there through the various vendors, and honestly, through the years, they've gotten better and better and better. And that was something my program director even had told me, hey, look, you guys do a lot of procedures here, but there's never enough. So, he said, go to Abbott, go to, Boston Scientific, go to Medtronic, whoever's offering it, just, try to make it if you can. Lastly, you really can't get enough of the bread and butter procedures. You really want to make sure, I mean, the advanced procedures are fantastic, but make sure you get a solid foundation of the bread and butter procedures, because, the more the repetitions you get, the more you're going to experience, and the more, things about, what complication can occur and how to, correct for that, that you'll learn. So really, again, repetition. Oh, one last thing that I remember my program director telling me this, and this always stuck out in my mind, because I'm not even there yet, but he said that it'll take you about 7 years as a practicing interventional pain physician to get to the point where you're confident enough where, literally everything can hit the fan, and you're confident, and you take a deep breath and you say, you know what, I can do this, and you move forward. So again, it's just about repetition. Get as much as you can during fellowship.
And Dr. Esposito?
I would add this pearl, and that is that you're not going to learn everything in fellowship, and don't feel like you have to. So, starting July 1st or whenever it is you all start, take a deep breath. Realize that you're going to be pulled in a few different directions during your fellowship year. You're likely going to have your primary specialty boards that you're going to be studying for. So take a deep breath, realize you're not going to learn everything, and that's okay. But still double down and try to get the most out of fellowship by leaning in. So like the rest of these panelists have said, really engage yourself, whether it be with finding a mentor who you feel like you kind of hit it off with, or whether it be, trying to do things repetitiously to get that muscle memory. But realize that that fellowship is really the foundation. So take a deep breath. You'll get through it, and hopefully throughout this webinar, we'll be able to give you a few other pearls here and there on how to do that.
And Dr. Victor, you are in your last few days of fellowship. What is one thing that you wish you had known at the beginning?
I would have just asked a lot more questions. I feel like at the beginning, you're kind of nervous. Everything's over your head. As the year progresses, you find out more about what you should ask and what you want to know more about. But I would just keep asking questions and ask the same questions to all your attendings and find out why they do things the way they do.
And so, as we heard from all the panelists, one consistent theme that we've seen in terms of fellowship training is that there's a lot of diversity in that. From it being such a short time span, there's primary certification. Some specialties have an oral certification as well. At the end of the year, there's finding a job, there's potentially moving. And so with all of that going on, each fellowship is not created equal. Some have strengths and inevitably have strengths and weaknesses in other aspects. And so as was commented multiple times here, you're not going to learn everything during your fellowship at a particular program. So I'll ask Dr. Jassel, what is the most important skill or skill set to learn, knowing that you're not going to get everything in a particular program?
So I think the most important skill set to learn is just general proficiency of basic procedures. And I would say that basic procedures can include things like epidural injections, medial branch blocks, RFAs, SI joint injections, etc. Dr. Azim said very clearly before, it's don't forget about the standard bread and butter procedures. These procedures are going to be literally your stepping stone to do all the advanced interventional things that you may or may not have an opportunity to be exposed to in fellowship. Let's take an example of some of the hot new topics, and I know that you guys have recently may have tuned into our minimally invasive SI joint stabilization lecture. That's one of the examples of how doing a proper SI joint injection from medial to lateral, making sure they're getting intra-articular joint spread, doing a proper joint injection will literally cue in to place a proper Steinman pin, as well as to go through the sequential procedures to be proficient at a advanced high-level procedure. And so, these are all things that are really stepping stones for the next step. So that's one thing that I can't, sort of stress enough. Make sure you learn your proficiency in the basic bread and butter procedures. Intralaminar epidurals will be the key or the highlight to get you in to do spinal cord stimulation, whether it's being a trialer or both a trialer and implanter, and as well as DRGs. So there's many things that you can really set the or the milestone for you to be a future advanced interventional pain physician. And I know a bunch of us will probably, key into the fact of how pain management is changing, but I think these are very important tidbits for you to learn.
So, Dr. Azim, one thing that was mentioned there is that the field is changing, and then there's some important skill sets to learn as a stepping stone to more advanced procedures. But can you walk us through kind of what's changed since you were a fellow? And certainly for all of us, there are procedures that we do very routinely that we never did any of during fellowship because they never existed. Can you talk a little bit about that and kind of how that progressed and how you've kind of made those next steps in your career with these newer procedures?
I feel like you're asking me that question because I'm the oldest one. So, you're absolutely right. I mean, honestly, when I was in fellowship, we had, one of the more advanced procedures that we did was spinal cord stimulation, and that was way before, Nevro was even a company. We had 3 main companies that did spinal cord stimulation, and there wasn't different frequencies and different, waveforms that were out to choose from. Even though the procedures themselves are very similar, if not the same, in terms of the techniques, it's just new technology that we didn't have. Beyond that, dorsal root ganglion stimulation has been a game changer. And for patients with CRPS, that's something that we never had before. And we've seen, everybody on the panel right now utilizing that therapy in their practices very well and getting even, better results than we had with, the technology that was there at the time when I was in fellowship. Beyond that, you have these more minimally invasive surgeries and like orthopedic type procedures like the interspinous spacers and the SI joint fusion that Dr. Jassel alluded to. These are all fantastic procedures that we now have in our, tool belt to be able to offer more comprehensive interventional pain management as opposed to before where it was the bread and butter and spinal cord stimulation, throwing a kyphoplasty there for vertebral compression fractures. So yeah, there's been a whole lot of stuff. And again, I feel like you're picking on me on this one, but because I did fellowship quite a while ago, but I will say it's a fantastic time to be coming out right now out of fellowship because there's so much more that you guys have to offer. Again, with that being said, you want to make sure that you do establish a fantastic, proficient skill set and use those, introductory procedures to build upon.
So Dr. Esposito, taking a big step back, we've talked about DRG stimulation, spinal stenosis procedures, SI joint stabilization. What would you say to the incoming fellow who is on this call who has no idea what any of those things are? Because if you were to ask me when I was an incoming fellow, I would have been that guy. So what would you say in terms of just gaining an understanding of what interventional pain is and what it's about? Can you outline kind of what the field looks like and what they have to expect in terms of their career?
Yeah, sure. And the question is how to find out about these things, right? So again, it's about leaning in. You have these great mentors, these attendings that are going to be in your fellowship. And it's likely that each of them has kind of a unique subspecialty within the pain field, whether it be neuromodulation or, a research aspect or what have you. And so, take a little bit of an interest and really just chat with your attendings. But let's also remember that fellowship can be very different across different fellowships. So I would also encourage you, whether it be in a state society like this, or if you're in a city with many fellowships to get to know other fellows. And you can do that through societies, or, potentially pick a conference or two to go to, maybe one early on in your fellowship. That way you're able to meet other physicians, both fellows and seasoned pain physicians. You can interact with industry at the exhibitions. And this is where I found a lot of treatments that I really wasn't familiar with outside of fellowship. So I think these are a few different aspects or things that you can do to really wet your whistle. And then there are some journals that are good to subscribe to. And even if it's not your own subscription, but I'm sure your fellowships have these as well, whether it be neuromodulation or pain physician or pain medicine, pain practitioner. There are several of these that are always very robust with literature regarding interventional techniques, ones that have been around for a while, some that have been around, have gone away and have come back, and then those that are of special interest, more currently. So these are a few different ways that you can go about finding what it is and what the field of interventional pain is all about.
We do have a question in the chat box here that kind of piggybacks on that. I'll throw this out to whoever wants it. How would you advise the best way to network in a time when conferences are being canceled or made virtual?
Well, I'll start, and I'll say that in this unique time that we're in with all these virtual webinars and conferences, I think that our field has really stepped up to the plate. And it's not just our society, but there are other societies. You have industry, which is very involved, and all of these entities are invested in the education of all pain physicians, both those in fellowship and those that are out in practice. So I think being involved in a society or two and potentially talking to some of the reps that maybe come around your fellowship to see how else you can get engaged with some of their activities. I think these are good ways to get to know at least perhaps leaders in the field, and those that hopefully one day when we are able to get together again, you'll recognize and you can connect with in person at that time.
That's such a great answer, Dr. Esposito. Do you mind if I chime in on that as well? One thing that I've always learned is to seek mentorship, and you're going to hear that term just time and time again. It's a very powerful thing to seek mentorship, and not only should you seek out a mentor or possible mentors, but really seek out the mentors that really are in it to help you. But that goes two ways. You really want to be a great mentee as much as you want them to be a great mentor. So, I know myself as well as a bunch of the panelists here, we constantly have other people that reach out to us, and, we try our best to make times for a conversation while we're, riding to clinic or riding home from the surgery center in the AMs or PMs. We're all more than happy to help, but I think it's just finding the right types of mentors. And I think that will really help pave the way for your future, especially in a time where networking is just sort of minimal this year when conferences are being canceled. So I think that's a great question, but this shows the importance of you stepping up. And as Dr. Esposito says, it's just leaning in, really seeking out for that advice or mentorship and really reaching out.
I would even add, if one way to develop a mentor-mentee relationship would be to, reach out to someone who you may have met or seen virtually like this or in another webinar, and ask if they have any research projects that you can get involved in, because then that will automatically start a line of communication between the two of you. And, that can also help just in terms of improve your knowledge by, going through the research process or the lip searches or things like that. So there are multiple benefits to reaching out that way. There was another question that came through kind of along the same vein, was that, what do we do about getting the experience for advanced procedures with fewer cadaver labs? And so I'll let some of the rest of the panel answer this, but I think being involved and knowing different vendors can help assist with this.
Mike, I think this one might be a good one for me to actually take because I can share from personal experience. So I trained in a program at the University of Florida about 5 years ago, in which at the time we actually were not doing a lot of advanced procedures. I probably did between, I'm going to say 10 and 20 spinal cord stimulator implants during my fellowship, and just about that many trials. And so it's not a terrible number, but it wasn't a number that that allowed me to feel, and these were all with another fellow, so that it wasn't a number that allowed me to feel entirely confident doing advanced procedures on my own. But through forums like this and society and different avenues, I was able to kind of come to the conclusion that these advanced procedures were the future of our field. And so really spending a lot of time in the first year or two outside of fellowship, honing those skills by seeking out cadaver courses, seeking out peer-to-peer trainings where you go and visit another physician, seeking out just dialogue with more experienced physicians, and then implementing these in the safest and most effective way you can into your practice until you start to feel more comfortable with them. So I definitely would say that it is very possible for you to practice in a little bit of a different way than you train. But at the same time, it is important that you do that kind of in a deliberate and safe way as you kind of hone these new skills and not just jump right in without knowing the right way to do it. Dr. Victor, go ahead, Dr. Azim.
So I was just going to say, so to jump on kind of what you're saying, and Dr. Esposito mentioned this before, but I can't stress this enough. So even before the pandemic, I felt like the reps for the industry, I mean, they are such fantastic resources. Everything from, maybe even being able to bring in artificial models and things like that to help with training so that, in lieu of cadaver courses, but even, and we'll get to this a little bit later, but, finding jobs and mentors and things like that. I mean, these are people that are networking with their counterparts in other cities across the country, and they have a lot of information. In fact, I've had reps that have reached out to me many times saying, hey, there's a fellow that's looking for a job in Florida, would you mind talking to this person? Absolutely. So I can't stress enough that the reps are very, very important in this manner. So just wanted to make sure that we stress that.
There's been a constant theme of kind of overcoming some obstacles, whether it be lack of training in a particular area, whether it be the coronavirus, whether it be whatever the case. Dr. Victor, you had some changes in your fellowship in terms of the coronavirus, different staff turning over in your fellowship. What were the biggest resources that you used outside of your fellowship to kind of further your education and put you in the very successful position that you are in right now?
Oh, absolutely. I was kind of bummed. We had 2 months of downtime where we couldn't do any procedures. Thankfully, we picked up back up again. It seemed like our numbers were through the roof, trying to catch up on patients that were waiting to get injections and procedures and implants. But I think, coming from a program with a lot of different interventions, I really felt like this past month has been really eye-opening, and I've got a lot of hands-on experience, thankfully. But I think just the webinars that we've been having online through Zoom via different reps and different like Medtronic, Nevro, Abbott. They've all been so helpful, and I think having these question answer opportunities also has helped a lot as well. But nothing compares to having a hands-on experience, and I'm hoping everything will kind of settle out, go back to normal come July.
And piggybacking on that, I know you were able to attend some national conferences this year. What was the importance of that for you, and maybe how did that change your perspective, moving outside of your home program?
Yeah, absolutely. We've had a few opportunities, one of which NANS in Vegas this past year, and there was one in Tampa that was really helpful. I think just like meeting, like you said earlier, meeting with other fellows, talking about what they do, and talking to other physicians in private and academia, and getting hands-on experience with the cadavers. And then networking is a big thing too, especially if you're not in the state that you're going to be hopefully settling in. You can meet people from the state you're hoping to go into, and network that way. But I think thankfully we have technology that we can communicate with people via the internet, even if, we're still kind of in this phase of not being able to go to conferences.
And we are kind of close to the halfway mark. I want to just do a few check the box type items before we move on to some really important topics that were in the chat box. Any suggestions? I guess we can ask the most recent fellow, Dr. Victor, suggestions for textbooks or other educational resources.
I actually have a list right here. Just texted a colleague of mine. So there are a few, one of which is and I remember you had recommended it to me, an atlas of image-guided spinal procedures. I'm sure, I don't know if we can email this. I have a list of books that I got. One was by Dr. Furman, which is really good. Of course, for boards, question books are really good. And I have a few of those as well. But I think just trying to find 3 good, really good sources. I don't think having too many is really a good idea, especially since, as mentioned, 1 year is really short. So I think having a question book and a injection book to know what images you're looking for will be really helpful.
Awesome. Dr. Jessel, do you suppose, this is from the chat box, do you suppose this pandemic will have permanent implications on practice and industry? And I think it's referring to telehealth. What do you think telehealth has done for us, and what will happen in the future?
Sure. I mean, that's such a great question. I think all of us are wondering the same right now. I practice in Central Florida, specifically in Polk County. And in Polk County, I know that there's a limited amount of pain physicians in the area because the county is it spreads really from parts all the way just east of Tampa, all the way west of Orlando, and pretty south as well, and pretty far north. So with that being said, I hope it does. And I know personally in my practice, I think it's improved access to care for many patients that just financially don't have the means to come out and make their visits and learn about the best educational options or therapeutic options for their pain. Specifically, I mean, I'm able to educate my patients on high-level advanced procedures through lots of educational softwares and things that have been given to me by resources from device companies and such. So I hope it does. I really hope it does. And I think that's the $1 million question. And I think we are yet to see. But with that being said, I think there's also pitfalls to telemedicine. I know that nothing's going to replace a hands-on physical examination. Coming from a physiatric background, I think it's so important when you're engaging in simple to advanced procedures to make sure that you're adequately diagnosing the patient right. And I think part of that is putting your hands on a patient specifically. So, I think there's pros and cons to it. I hope that we can use it more and it's more readily available, more from an access to care issue. And we'll just see. And
a great reminder to, don't forget the basics. History taking, whether it's done over telemedicine or in person, is the number one way to start figuring out what's going on with the patient. And certainly learning your physical exam maneuvers and kind of honing in those skills and honing in your presence in the exam room as the physician, kind of how that flows, and as you kind of mature from a trainee who's still learning to running a show, so to speak. So this transitions really nicely, Dr. Azim, to our next question. And I suppose that the majority of our time probably is going to be spent on this topic. When would you recommend to start looking for a job?
It's a great question. So, you know, I'm an avid believer that, you know, the earlier the better. You know, I think that you give yourself more opportunity, you know, when you start earlier. I'll tell you, based on my experience, I think after the first quarter of the year in fellowship, I had started to go ahead and, you know, put my CV together, started looking at different areas, started trying to determine, you know, what type of practice that I wanted to be a part of, you know, whether that be, you know, academic, private practice, hybrid practices, hospital-based. You know, so I think that you can never start too early with planning for that. The biggest piece of advice I've given fellows before is, you know, geography makes a big difference a lot of times. And I think that, you know, what you want to do is make sure that if there's a certain area that you really, really want to get back to, you know, whether it be for family or, you know, explore, and there's a number one place, you know, the statistics aren't fantastic regarding staying at your first job. And so what I always tell people is, you know, find a place that's kind of close to that area, maybe outside of a non-compete type of situation. And then, you know, maybe, you know, keep that in the back of your mind, because what you don't want to do is if you have family in an area or you want to return to an area or go to a specific area for the first time and things don't work out, then, you know, depending on the state you're in and where you are, and also your previous employer, you may not be able to practice in that area for 1 to 2 years following, you know, leaving that initial practice. But I think in terms of planning, again, I think the earlier the better. And I think that only good will come out of, you know, being more prepared.
I'll
And
check.
can we just-
Go ahead.
Sorry, go ahead, Dr. Victor.
I started in October, and I kind of around November kind of lost interest in trying to find it because it seemed like it was too early at that time. And then went to NANS in January and then picked it back up. And I signed on in end of March, right before COVID, like the lockdown. And there was a hire freeze, of course, at that time, shortly after. So I agree with you, Dr. Azim, like it's good to get your CV underway at the beginning of fellowship so that you can start looking, but don't feel rushed or pressured. It'll happen in due time. It just, things will fall into your lap when it happens.
I also think there's at least when I was a fellow, there was a notion out there that you don't even have to start thinking about it until, you know, December. And I would say that's absolutely wrong. You know, start looking now. You know, just keep your ears open, keep your eyes open. Could we just go down the line real quickly just to give some perspective to those who are watching, and maybe that can help guide some questions to some of our specific panelists. Let's tell everyone where we practice, the model of the practice, and if it was our first job. So I practice in Gainesville, Florida. I'm in a group practice, and it was not my first job in private practice. Dr. Esposito?
I practice in the Melbourne area of Florida. It's a private practice, and it happens to be my first job, and I've been there for 5 years.
Myself, I practiced in a private practice setting for my first 4 years, and I basically went out on my own about 10 months back, and so I'm in my own solo practice in Central Florida in Lakeland for the last 10 months or so.
So I'm also in private practice. I own my own practice and going to about 2.5 years now. This is actually my third position. Out of fellowship, I joined a private practice pain group in New Orleans. Then after that was with an orthopedic group for a couple of years, and then decided to hang on shingle.
And just to give some context to everybody that's watching, you know, I think the maybe misconception for trainees is that there are two options. There's academics and there's private practice. There's actually probably about four. There's academics, like Dr. Victor is going to start in a couple days. There is a independent solo private practice, like Dr. Jassel and Dr. Azim. There is a hospital-based practice that you work for a hospital, and none of the panelists are in that model, but many of the people that we know are. And then there's a group practice, like myself and Dr. Esposito. So even knowing those details of, you know, what I just said in the last 30 seconds are things that you will learn more about. And if all of that was new for you, I would certainly advise that you ask questions about it. And it's not unexpected that it is new for you. You know, these are all things that is just part of the learning process. Let's jump back into the topic of finding a job. What were the best, Dr. Jassel, in terms of coming straight out of fellowship, what were the best resources to learn not only of job opportunities, but you get a contract and you don't know the details, and how do you know if it's fair? How do you know, how do you go about teasing that out?
Wow. So, you hope for the best. No. In all honesty, you are going to ask people, and you're going to ask people that you trust. And I trusted a few mentors. There were two in particular that I kept in touch with from residency. One that I kept in touch from medical school that were both pain practitioners. One was in private practice in Manhattan, and the other one was in a private practice model somewhere else. And that was important for me because I wanted to be in private practice, so I decided to seek out those types of mentors that meshed what I was looking for specifically. I couldn't stress that enough. Make sure you ask questions. The next thing is when you're looking at a contract, make sure that you have a lawyer vetted out. It doesn't matter who you have that is a friend. It doesn't even matter if your friend is a lawyer themselves. You really need a special contract lawyer who's familiar with healthcare law to really review your contract. And if it means spending a few dollars up front, and I know that everyone is limited to cash flow, especially graduating from residency, graduating from fellowship, but I think it's important that if you've vetted out between one or two private practice or academic practice scenarios, but more so private or group practices, really making sure you have a healthcare attorney just vet out the contract for specifics and make sure you do that. I think those are key basics. Interview in as many places as you can, because you really don't know what you're looking for when you graduate fellowship. I know when I was in the stage that Dr. Victor was, I was still kind of torn. Was a group private practice model my model? Do I want to be with a single solo practitioner who's looking to expand to one additional physician? Do I want to be in a hospital-based private practice, which it's RVU-based? There's so many different models within themselves that have different reimbursement scenarios as well. So you really just want to kind of interview to as many places. And by interviewing, you actually gain a lot of just valuable information. And that's the one key time where you're actually going to have certain individuals open up their practice opportunities and just telling you what it is their practice setup is like. And I think I must have interviewed with at least 12 different practices or groups during the 6 months, my first initial 6 months while I was in fellowship. And so the first 6 months is actually key. And you actually develop for what your pros and cons of what your likes and dislikes are. It'll really shape you into finding out what you're looking for.
Dr. Esposito, how do you figure out what type of job is the right fit for you in terms of your personality, your desires? How does a prospective fellow go about figuring that out?
Well, I think it would behoove each and every one of us to do what we do when we try to make other challenging decisions, right? I mean, sometimes you may talk to family or friends or mentors. I sat down, I just wrote things down that were important to me. both in terms of, geography, in terms of practice type, in terms of whether it be vacation or compensation, in terms of what I wanted to intellectually get out of my job. So, I jotted all these down and I tried to rank them, if you will. And then that's how I sought out to start my search. And then I went about asking people if they knew of opportunities, whether it be mentors or previous graduates of the program that might be in the geography I was looking, or talking to reps that may know people down where you're looking. So each individual has to come about and think about what it is that's important to him or her. And then from there, you can really decide what type of practice you want. So if hey, I just want to work 8 to 5 and I don't want to have any, call or anything like that. Well, maybe an employed, position, for hospital might be one, or private practice. Or if you're like, hey, it's all about, I want to, work a lot and work hard while I can. And I just want to, be really busy. And then I want to kick my feet up down the road. Well, then maybe you want something that, incentivizes you to be, busier and more productive. So there are different aspects and different considerations that each individual has to take into account, and be honest with yourself about what are those things that are important.
One thing I would add is that as a new grad, and training in this day and age with the field changing so rapidly, there's good news and bad news. The good news is that as a graduating fellow, your skill set, regardless of where you train, if you seek out the right opportunities for mentorship, additional training, all the things that we've talked about, regardless of where you train, is probably going to have a higher ceiling potential than someone who's been in practice for 25 years. So you will be more attractive in that regard. The downside, or the bad side, is that there's a little bit of unknown, and you're at the highest risk for being taken advantage of starting a new job. So that's the reason why there's just an abundance of caution being expressed by the panelists in terms of looking for a new job. We do have one more question from the panel here, and it's a little specific. How about Dr. Azim? What would you consider when you were evaluating a surgeon-owned group practice? What would be the specific things that you would want to know?
That's a great question, because that is something that I think a lot of us have had to deal with in the past. And I think that there's a lot of pros and cons to joining a group run by a surgeon. One of the things you have to understand is that most surgeons don't really understand our specialty very well, or what we can offer. So first and foremost, I think that, even though it's difficult to, come out of fellowship and negotiate from a platform of strength or power, I think what you need to do is make sure that they understand that, you're not there just to prescribe, medication, that you do have a skill set that you've, been trained in, and it's not just necessarily the bread and butter, unless that is something that you choose to do and would like to stick to. For all the attendees that are looking to do high level intervention, sometimes you may get some resistance from orthopedic groups once you start. So you want to make sure that you are upfront about everything, and make sure that they know that you plan on pursuing high level intervention if that's something you want to do. One of the other things you have to take into account is most of these orthopedic surgery groups do have some kind of affiliation with a surgery center, may just own a surgery center outright, and may want you to do all your procedures there. And that, which is fine, because there's different types of contract models that may actually reimburse you pretty well for that, and that may be good for you, even long term. The thing that you want to understand is that later on, when it comes to partnership and things like that, you want to make sure that you understand that there are differences in overhead costs for the group practices. So what we do with these interventional procedures does not take a lot of, or does not lead to a lot of overhead costs. But Surgeons do require a lot more equipment, a lot more assistance in certain settings. And so those overhead costs can also be something that you want to make sure that you discuss with them and having a fair way to divvy that up. But I think the biggest thing is when you're negotiating with an orthopedic or any kind of surgery owned group, you want to make sure that you get out what you want to actually be able to do, and not rely on them just understanding or assuming that they understand everything that you bring to the table.
So one thing that we kind of have seen with a couple different questions and answers is, figuring out what type of pain medicine physician you want to be is kind of step number one. And there's a wide spectrum of that. There's, conservative, non-interventional techniques. There are simple percutaneous interventions, injections, and ablations. And then there are these other groups of procedures that are actually minimally invasive surgical procedures. So I'll ask the question for the panel because I'm surprised that this hasn't been asked before. So Dr. Victor, you are an anesthesiologist, correct? And you came into an interventional program and then they asked you to do surgery. How do you figure out how to do surgery?
Learned on the job. Of course, it didn't occur to me, the amount of stuff I didn't know until I went to fellowship, but you pick it up pretty quickly. You just need to practice. And you learn the bases in fellowship that you can carry on in the years to follow.
And that's one thing that I definitely would want to highlight. And there may be panelists or there may be attendees on the call today that kind of don't even realize that the highest level of our field is actually minimally invasive surgical options that involve basic surgical skills like making an incision, closing an incision, dissecting soft tissue, things like that. And so, it's just important to understand that that is within the range of what you could potentially do if you wanted to, seek that out. And along those same lines as figuring out what type of interventional pain physician you want to be on the job search, figuring out if you're joining a group setting, what type of interventional pain physician they're looking for. And that was mentioned in the chat there. We've mentioned a little bit about industry, but Dr. Esposito, can you talk about the role of industry in the field of interventional pain and in the role of training? And because I think some people in the audience may not know why we keep talking about industry.
Sure, absolutely. So there are a few facets in which you'll likely encounter industry. One is with education and training. And so I like to think that our field of interventional pain has a very good relationship with a variety of industry vendors because it's expensive to train physicians to do the things that we need to do in order to best take care of our patients. And so industry does share some of that burden. Now, don't get me wrong, certainly there's there's a benefit to industry and each vendor to teach physicians how to do these procedures. But there's certainly a team effort in this regard. The other aspect that you're going to interact with industry is likely going to be with research. And that a lot of these techniques, a lot of these procedures, these devices, they're not inexpensive. And so there's that inherent challenge of being able to run and fund studies that can demonstrate safety, efficacy, and in some cases superiority over other treatments. And because of the cost, vendors or industry will help with this. And so I'll go on a slight tangent and say you have to give that some consideration when you're evaluating certain manuscripts that are published in journals, right? Just for biases and whatnot. But generally, these are the two areas that I see industry being integral in our field in terms of research and in terms of physician education.
And Dr. Azim, circling back to kind of why we're here, what is the role of society in a fellowship, and then also as we transition into practice?
So that's a great question. I mean, I think societies are very, very important to be engaged in, for everything from, rubbing elbows with and making connections with people from across the country that are like-minded, potential job opportunities, potential collaborations for research and papers. So I think it's very, very important, as well as advocacy for our field, because of the fact that, unfortunately, CMS and insurance companies a lot of times will, lead to cutting our reimbursements and things like that for some of these novel therapies that we have that are very effective and data driven. So I think that it's an integral part of, becoming a good physician overall, irrespective of field, is being involved in whether it's a state society, national society, both. And I think that you really want to look at the mission statements for each society and see kind of what they're about, and if it aligns with your interests. Because if it does, then you really want to align with the correct societies and not just don't use societies just for CME credits. Actually, utilize them for all that they offer. And
as we kind of get down to the end of our time here, I want to be respectful of everyone taking the time on a weeknight here. And again, thank everyone for joining us. And this kind of engagement and dialogue is not just a one-time thing for us. We certainly have plans for future engagements with trainees and fellows. But Dr. Azim, I'll circle back to you just for one final closing thought from everybody, and we'll start with you.
Thank you very much. So again, I'd like to thank everyone for taking the time as well. I'd like to thank our panel, because we've kind of mentioned this throughout, but having good mentorship and advice from people that have kind of been through the trials and tribulations is really so important in your career, and how you're going to advance. Everything from the picking the type of practice to contracts and things like that, as well as these high-level interventions and how effective they are in the right hands, and appropriate patient selection. All of these things are things that your mentors and physicians like all of us that really take our time away from our personal lives in order to help to communicate that to everybody and advocate for our field. So what I would tell you is that I think that the future is very bright for our field, and I think that as been mentioned earlier this evening, that we're going to continue to grow, and we're going to continue to be able to add more advanced procedures to our tool belt. And I think that it's just a fantastic time to be coming out, and I encourage all of you again to align with societies that promote your interests, and look forward to hopefully meeting every one of you when we are able to do our society meetings and cadaver courses.
Navdeep?
So, well, great comments. How do I add on to that? Well, let me start off by saying congratulations to the class this year, and Dr. Victor, all of our other colleagues. But the one thing I want to point out is your education does not stop today. It actually starts today. And I know personally for me, education is lifelong. I know that I was telling the panelists here right before we started that I tried a new novel procedure today. I know personally, for the last, 2 weeks, I was reading up on brushing up my ultrasound techniques and my skills, making sure that I knew exactly where I was going to, implant a particular peripheral nerve generator that would seek out the right opportunity for that patient to have the best possible patient experience and patient outcome. So your learning and your education does not stop. It actually starts, and it continues for the longevity of your career. So that's one thing I'd like to point out. The second thing is, as you seek out education, as you seek out mentorship, make sure that you do so, and you do so for yourself. Make sure that you're reading papers for yourself, not just reading abstracts, but really solidifying thought and critically appraising these journals for the value that they have in every particular article for content. And I think that's very important. Make sure that your judgment is based on critical appraisement for each and every other journal, and making sure that you have your solid fund of knowledge based on what you think is accurate. So I think those two things are key. And again, I congratulate all the fellows for graduating this year, and I look forward. Your future is bright, and interventional pain is bright.
Dr. Victor?
I got about 4 points to make, and I'll make them quick and real short. Number one, know your patients, look them up the day before, know what medications they're on, look at their imaging, and look at everything about them, because your attending will ask you, and it's good to just really know your patients for patient safety, and you can learn a lot through that. The other thing too is I think it's important to be not only hands-on in the procedure setting, but also in the clinical setting. I mentioned in the chat, you really want to be a good diagnostician. You want to know what to look for, what's the best therapy for your patient, and that's half of what we do. And then the rest is interventional as well, and medication management. So I think it's really good to do that, and keeping in mind that you must share with your fellows. And if you find that your co-fellow isn't getting enough spinal cord stimulation, I think it's good to kind of make sure that they are also getting some action as well. And I think it's really great to discuss about cases with your co-fellows. You learn a lot from them and what their experience is and what troubles they had, because like they said, it's only a year. And so not only will you see things and learn from it, but hearing about it too is really helpful. And then the last point I wanted to make was, when it comes to suturing, I did not really have much background at all. And Dr. Anthony, I'm sure you remember that, but I think practicing on a kit they can get at home, because whatever opportunity you get in the OR, you want to make sure that's the time that you perfect your skill. It's not so much for practice, but just for perfecting it. So I recommend getting a kit during fellowship and practicing at home.
And Dr. Esposito?
Well, those are all great points, and it's always most difficult being the last one. So I'm glad I'm not the last one, and you are, Dr. Anthony. But what I'll impart on all of you is, the business of fellowship is fellowship. So again, take your time, lean in. I would reiterate what everyone else said, but also realize that medicine is changing, right? The field, our field will continue to change. We can look to, the field of cardiothoracic surgery and now interventional cardiology. I think we're going to see this continue to be the way that our field changes, in that more interventions, more spinal procedures are going to become more minimally invasive. And right now it's an open field, and with our skill set and our desire to learn more and to be able to do more, we're going to fill in that gap. So we're going to be called upon more and more. And so that's where, lifelong learning really comes in, because, you're going to be able to teach anyone how to do an epidural. And, beware, there are some nursing fellowships out there where they are teaching nurses how to do what we do. At least technically. So it's important for us to be able to, provide the best quality care that we can, and to continue our lifelong learning. And in that vein, I think all of us here on the panel are committed to education and collaboration and teaching. And for those reasons, we continue to put on more webinars in order to educate all physicians. And we also plan on hosting regional cadaver labs. And so we would very much encourage all of you on this call to participate in those when those are scheduled. Unfortunately, with COVID and everything going on right now, we had to postpone the one that we were planning on doing. But as soon as things are safe and more reasonable, we do plan on pushing forward with that in order to fill in educational gaps that one may experience in fellowship or early on in practice, or just for those who are interested in learning more and being able to provide their patient more treatment options.
And I couldn't possibly add anything more to what's been said. I'll just put a little plug in for our next webinar, which focuses on intrathecal therapies, which is a topic that more and more fellowships are actually not having the exposure to. And I'll just point us back to fspndoctors.org for membership opportunities. If you'd like to kind of link up with our society for further engagement, that would be definitely something that we'd all be interested in. I see in the chat it is July 7th, not June. So that is correct. And my final thought would just be that the reason why everyone on this panel, for me personally, even though we all live in different cities, have become extended family for me, is because we spend so much time together, whether it's in person doing things, or whether it's virtually like this, or whether it's on calls, or just discussing different cases or whatnot. You will build lifelong relationships in this field, and those are really something to be valued. And the reason that we are also like-minded is because honestly, we're all a little bit selfish, and that selfishness revolves around the desire to further our field, but also to protect it. And so we are interested in putting out quality, research, quality educational opportunities that's going to teach people how to do it the right way. And we certainly hope that everyone on this call is kind of that like mind and will be trained in the same way. And so please don't hesitate to reach out to any of us, and we hope to see you for our next event. Thank you, everyone. Good night.
Thank you.